Hello, and welcome to the Caregiver's Compass, where we guide you through the journey of aging, caregiving, and life's most important transitions. I'm BreJeanna Webb. I'm a senior care and transition strategist, a licensed realtor, and the founder of Compass Senior Living Advisors.
And I'm Crystal Godette, the Director of Clinical Quality and Program Development, here to help you understand the care side that'll help you make confident and informed decisions. Together, we'll help families navigate senior care, housing options, and emotional decisions that come with it so that you don't have to do it alone. Let's get into today's topic.
Hospice, why are so many people afraid of it? When families hear the word hospice, fear immediately sets in.
They think that it means giving up or that death is imminent, but that's not the full picture.
Today we're having today we're having an honest conversation about hospice, what it is, what it isn't, and why so many people are afraid of it.
Yep. And so, welcome back to part two of our segment of Hospice is Not a Death Sentence. If you watched part one, you met Miss Shawn Jenkins. She is our hospice liaison and hospice professional with a wealth of knowledge, and she'll just be here to teach us some more. So, buckle in and let's learn something from her.
Yes. So let's talk about care and service options. We're just going to dive right in. And you did mention briefly on our first episode, respite care, which is something that the hospice provides. Can you just kind of give us a really good in-depth look at what does hospice provide? And I'm going to add to that because it ties together, which is who is a part of this hospice care team.
Yes. So hospice provide basically four levels of care. You have routine hospice care, which is most common. We come into wherever the patient calls home, and we take care of them holistically. So when we say holistically, it's like mind, body, and soul, just like it sounds. So we have the chaplain support, which is chaplain services. Come and pray with you. We don't push any particular religion. We meet the person where they are. Um, we have social worker support that I mentioned on the first segment. Social worker support, the aides coming in, home health aides, which comes and help with grooming and things like that. So that's the routine care. And then, as you mentioned before, from the first segment, respite care, which is inpatient respite care. Respite is outside of the patient, wherever they normally would call home, which usually is from a person's home. So if they're already in a facility, you don't need the respite care because they're in there already. But inpatient respite care for patients who are at home, because most of our patients are at home, at their own home, goes into a facility of their choosing. We'll tell them, hey, this is who we're contracted with. If you want to take a look at them or what have you, or depending on what their personal needs are, we may say, I think this one is best for you. So that's the second level, would be respite care. We have continuous home care. Continuous home care is not something that someone can come straight in and elect. It is more so you're having a hard time. Your symptoms are kind of unmanaged. You need a registered nurse. You need someone at your bedside 24/7. That's continuous care. So a nurse will come and say, hey, this person is having a kind of hard time. We need to, tweak the medications and things like that, kind of get them more comfortable. I'm going to stay with them 24 hours until we can get them more stable. So that's continuous care. And the fourth level is GIP, which is general inpatient care. And that's the hospital level. The highest level, which means it's urgent, it's a must. You're in a kind of dire situation, and we're coming and admit you at the hospital and take care of you there to get you comfortable. And so,
Wow. So, a lot of people, that's a myth that I've heard with hospice. They just come in, every couple of days but they do offer continuous care. That's really good to know.
mm-hmm. Yeah, we meet you where you are, and as you mentioned, also the different people that comes in to help you. So everybody's care is different. We
Mhm.
offer aides with Bristol 5 days a week, and
Mhm.
so some people may say, "Oh, I don't need them 5 days a week." We taper it, tailor it. How you may start off just 2 days a week for your aide. I just
Mhm.
want the aide 2 days a week,
Mhm.
but it can increase or decrease, depending on your need and your request.
So then to my next question, which was how often the staff visit the patient. So you're saying it could be from 2 days to 7, well, continuous care 7 days a
24.
week, right?
Yeah. So this is the thing. It is very tailored. And what happens is, I'll take you through the steps. A nurse comes in to do an evaluation for the very first time. And when she sees the patient, she says, "Okay, I feel like this is what they need." And she writes it in her care plan. The nurse, she might say, "I'm going to come and see this patient," or the registered nurse is going to come and see this patient once a week or twice a week. The aide is going to come and see this patient 5 times a week. I'll schedule the social worker maybe once every 2 weeks, and the chaplain will see what the patient wants, and maybe we'll do them once a week or twice a week. How Bristol tries to do it, they try to have you someone every single day, unless you say, "Okay, it's enough." But we try to have someone seeing you, putting their eyes on you, because we meet about you every day and say every morning and every evening and give an update on, "Okay, I saw this. This is what's going on." So we're constantly in communication, to take care of you, to be a part of your care.
Okay, good. So, with that being said, even though hospice comes in, whether it's home, facility, hospital, wherever you may be, um, some families find it hard to let go and let someone else kind of, take over that care, especially if you've been doing it for a long time. So, are families still allowed to provide care, or does hospice just kind of take over everything?
That's a very good question. We don't take over at all, because our presence is for a brief time. And so when a patient is at home, we try to teach the family different things, what they can do when we're not there. Because even though the aide comes once a day, like 5 times a week, her visit may only be an hour or two, depending on what all she has to do. If she has to bathe or groom, wash your hair, it only may be an hour or two. The nurse the same. It may be 45 minutes to an hour for her to do the vitals, and if you have a wound or something like that, do wound care. And so that other time it's on the family. And
Mhm.
so that's where we teach the family, hey, in between time, you'll have to take care. And in between time, are you comfortable giving this medication? We teach them how to do it and what to do and things like that. So it's still, we don't take over. It's still your loved one. It's still you. You can still do everything you need to do for them. We just come to be that extra layer of support, so
Right.
you can have a break.
Right. Okay. Well, and earlier you spoke about just the emotional and spiritual support that's offered both
Mhm.
to the families and to the patient or individual. But I know you had some goodies to go along with some of that support. So we just wanted to hear some more about those.
Yes. So with Bristol specifically, which
Yes.
is why I really love this company, we offer something called a Bright Moments Kit to make your moments brighter, right? And so it was originally developed by a nurse to and dementia and Alzheimer patients. This is our kit. And so
Okay.
to dementia and Alzheimer patients, and we realized anyone could benefit from it. So anyone on our services get this kit. This kit comes with a Warmy Bear. And he's an actual Warmy Bear, the
He is
brand. So
so
you can
cute.
put him in the microwave. He has like a lavender type scent. And he's
Oh,
warm.
calming.
And so he has little weight to him, little beanbag butt. And you can, once he's warm, you can put him on something that's aching. I've seen a grown man, about 6'3", over 200 pounds, carrying around this bear in a facility. And it was the coolest thing. And so they love them. It gives you something whole, has a very nice texture to it. And so he's our warmie bear. One thing that everybody loves, even the facility, they're like, I want one of those. This is a weighted blanket. And so the weighted blanket, it gives the feeling of a hug, right? And so, you know, like if you're swaddling a baby, it keeps the baby from being agitated, makes them feel more secure. This blanket calms down agitation. It's the perfect size where it's not in the perfect way, so it's not considered a restraint. And I can't take it out because it's so big, but it's families and patients love it. The other thing in the kit, we have my favorite because I do everything to music. It is an MP3 player. And what we do with the MP3 player, it comes with earbuds, it comes with a headphones, and it also has a speaker just in case, you know, that agitates you to put that on your head. We put 10 to 15 of the patient's favorite songs. Now, say the patient has dementia or Alzheimer's and, you know, they don't know the songs or the family doesn't know. We go to the era when they were like in their 20s, when they that long-term memory is still back there, and we put the songs on there. You would be so surprised how they light up and they sing along, and you're like, oh, how did they remember that?
Yes,
They love the music
so
therapy
cool.
with the MP3 player.
Yeah.
This is a nosy cup. And so hospice is about dignity, right? Dignity and comfort. This cup provides dignity because when a patient spills things on themselves or they feel like they're losing their independence, it makes them feel upset. This looks what it does. You can drink it like that.
I love it.
The nose is cut out, so you're not making spills. It's not hitting and spilling over. And so we love the nosy cup. The last item in the, two items, sorry. The maroon spoon. The color maroon ignites the appetite. And so it stimulates the appetite, make you want to eat. And it also has I'm going to mess up the word, ergonomic design.
Ergonomic.
Yeah, did I say it right?
Yes.
That word is hard. Design, but to keep you from choking and causing dysphagia and the aspiration pneumonia, because it keeps down to choking and gagging reflex. And the last one is a distraction device. So I like to call it like a little mini lava lamp. But when someone is agitated, it kind of just it gives them something to look at and do and keeps their mind distracted. The very, very last thing in a kit, which caregivers love, is just a guide. My guide is a little funky looking, but it's a guide. And so it's a caregiver guide, and it lets you know, hey, if your mom or your loved one is having sundowning, give them the blanket. Or if they're having this or that, it gives you a guide on how to use each one of the tools so that it could be more beneficial to your loved one. And so that's only with Bristol Hospice. Shameless plug, but Bristol Hospice. But that's our Bright Moments kit. Just one of our 4 specialty programs that we offer, and it's given to all of our patients to make their days brighter.
I'm in love with your Bright Moments kit. I think it is amazing and very thoughtful and well thought out. The intentionality in that kit is everything. Thank you so much for sharing that, man. That's pretty awesome. So let's talk a little bit. Everything that we've learned about hospice, the things that's offered, the things that people don't take advantage of. Why do you think so many families are afraid of hospice?
I think families are afraid because just of the unknown and the stigma from back in the day, what we've known. It's like I've had someone call me Grim Reaper lady. Oh no, Grim Reaper lady. And they just associate hospice with death. You get on hospice because you're dying, or I'm about to die. I've had families say they're not dying, or like they get very defensive, and I'm like, no, it's not about dying anymore. It's about living. It's about having a better quality of life while you're here. You're not getting any reward by suffering through it. You know, if you're going through this path already, why not do it with extra help or support? And so I think they're just afraid because hospice, it's a word that we were not educated about back in the day. So that's what we understood it to be. You know, we call, like for my own grandmother, you call hospice when your family is about to die. And that's just isn't the truth. It wasn't the truth then either, but that's how it was used. But it's definitely not the truth now. It's so many benefits that comes along with earlier support. And so I think that's the fear.
I was just looking up, like, what's the meaning of the word hospice? Uh, just to see. So tell me this then, with that fear, um, families with that fear and their family really could take advantage of and benefit from the services that hospice offers. What would you say to a family who feels like choosing hospice means they're giving up?
It's not about giving up. It's about switching your focus from curative treatment, curative care, to being comfortable along your path. It's not giving up at all. You're still living. It's about choosing life versus anything else aggressive. Because a lot of times a lot of families, they're not even seeking anything aggressive. They're just toughing it out. They're just at
Mm.
home toughening it out because they just don't know that there is another way. They don't know what they can have. And so it's not about giving up. It's about choosing comfort care, choosing a greater quality of life, allowing the support.
Mhm.
So I want to add to that. So what are you doing? I know in your introduction, initially, Crystal talked about you dispelling the myth of hospice. What are you doing to dismantle this fear of the word hospice to families?
Yeah. So my job as a hospice liaison is I go and I teach. So I like to say I'm a hospice educator. I go and I teach. I go to facilities because you'll be surprised, some doctors you know don't even want to talk about it. They don't want to mention it, and a family, they're like, well, my doctor didn't mention it. Why are you mentioning it? My doctor. Your doctor didn't want to mention it. Your doctor rather the hospital tell you because it's such a hard conversation. And so I go and I try to show that it's a benefit. It's not a death sentence. It's a benefit. You know, it's extra care when you need it the most. It's the highest level of health care, the highest level of health care that you can have. And it is truly a benefit. And I just paint the picture of the benefits to try to dispel those myths, to break down those fears, and have you say, okay, I'll give it a try. And that's why I love that question you asked, Crystal, that you're gonna get stuck on hospice. I'm gonna
Yeah.
get it and now I'm stuck on it.
Yeah.
Now I can't do anything or whatever. The mindset just makes up things, from fear. And so you're not stuck on it. That's one thing I like to say. Like if I see a lot of hesitation, you're not stuck on it. But if it's something that can give you a greater quality of life, greater benefits, and I like to say this, you've paid for it already. I've been working since I was 16 years old. And from 16 years old, I'm 43. 16 to now, Medicare comes out of my check faithfully. I might try to get some extra coins and go exempt from time to time throughout the year. No matter how exempt I go, Medicare still comes out
Yeah.
faithfully. So you've paid for it already. And
Mhm.
hospice is the most underutilized benefit of the Medicare program.
Wow.
Mhm.
And it's just because people don't know. And so
Mhm.
I paint that picture and just try to give the education. And usually it breaks down some of those fears. They'll continue on and give it a try, even being scared. And then they realize, oh, most patients say, I wish I would have tried this sooner. Families, I wish we would have done it sooner.
Mhm.
So,
And even with that, you talked about just doctors finding it difficult to speak to families and individuals about hospice. But what would you even say to other medical professionals? Because I know I've personally, and I'm sure BreJeanna has as well, had to have that conversation when no one else has. I've had, as a therapist, I've recently realized that actually one of your residents that I work with or used to work with, I'm the one that actually said to her son, hey, I love your mom. She is, oh my gosh, she's amazing. Like, even when you talked about the MP3 player, the only time I could get her to eat was when I played Michael Jackson. That was it. But I realized, even as a therapist, that was all I was able to do. She was still declining no matter how hard I tried. And so I was the one that said, nursing, or no one else decided to chime in. And I said, you know what? I can't necessarily push hospice, but I did have a good enough relationship with her son, because he would come in and ask how his mom's doing. And I suggested, talking to you or talking to the facility administrator or someone about what that option looks like. So how would you encourage other healthcare providers to start that conversation, even if they can't or not allowed to push it? Because we're not allowed to push it, but how can we interject in some way to help guide that conversation or start that conversation?
I think the best way is to kind of paint the picture of what you're seeing. Hey, I've been trying a few things with mom, and I noticed that she's not being as responsive. Maybe another level of care may be more appropriate for her, or they're so afraid of saying the hospice word. So I don't know, it's the comfort level of the professional, right? But it's just an evaluation or just a conversation. Maybe, I think that another level of care may be, you may want to explore it. I don't know if you've ever heard of hospice, but if you want to just, have an understanding or have some questions, I have someone you can talk to, or, because we can have the conversation. I'm equipped, or that's my error, my error, you know what I mean? And so you do therapy, and so you see what you see, and then I can have the extra conversation. So I think just painting a picture so they can start thinking like, oh, because sometimes they just want to push. No, mama, you need to do it. No, mama, you can move. No.
Yes.
No, she can't.
All the
She's
time.
doing all that she can.
Oh my
And so I think just being 100% honest and say, hey, it doesn't seem like she's responding the way that we would hope at this point in therapy. I think that she would benefit from an extra layer of care or support. Have you ever heard of or thought about, have you ever heard of the benefits of hospice? And they're going to say hospice. What? Yeah, like, yeah, no, just the conversation. It's just basically extra support. I have someone you can talk to and ask questions to, if you like to learn more. They shut it down a lot because it's the word hospice. I've gotten in front of someone recently. They just said an extra layer of support. Would you like to talk to someone? And, oh yeah, I would like to hear about an extra layer of support. They never said hospice. They let me say hospice when I got there. So
set up.
What's this extra layer of support? Well, we offer, a nurse that can come in. We offer the aides. Is this? It's called hospice, and you don't have to be, near death to receive it. And so I'll try to paint the benefits first, and then I'll say the support is called hospice. And it doesn't leave anybody. It's like, oh, okay, But when you say hospice too soon, it does, I understand from the professional side as well. It's hard to mention, but let me have the conversation. Just yeah, just let the person who's prepared for it to have the conversation, just get them to me. In a
Yeah.
sense, so
Yeah.
yeah.
All right.
Okay, well, we are at the end of another episode. Thank you so much for joining the Caregivers Compass, where we are here to enlighten, inform, and educate. Again, if you found any great information, any useful information from this video, we do ask that you like, comment, and subscribe. Also, share this with your family and friends. We will be back with one more episode here with our special guest, Shawn Jenkins. And on our last episode, I really want to focus in on family support, caregiver support, more things about the caregivers and the families, and practical and financial questions. And so we'll be back for one more episode. Please join us next week on the Caregivers Compass, where we are here to help you and support you and your family. Thank you, like, and subscribe.